Hi, Shireen. How are you?
Great. How are you?
I'm good, thank you. Thanks so much for taking time for us to chat. I'd love to learn about your practice. Can you share an overview of the work that you do?
Yeah, so I work in New York City and I work with individuals ranging from 16 and up. And I also welcome couples and families who also want to work on some of the goals that they have or any issues that they would want to work on.
Awesome. And what are some of the common challenges that people are seeing you for, or specialties that you especially focus on in your practice?
Yeah, so those who come to my office do have like wide range of goals that they do want to work on. But my specialties do include working with individuals who have depression, anxiety, trauma, grief, and also just navigating through life stressors. Something that I do also incorporate is EMDR. So with EMDR, what it does is it does help with someone who do have like trauma. So we use what we call tappers. And with tappers, it allows an individual to like feel some of the sensation in their body from left hand to right hand. And there's also sounds, what we call tones, that also coordinates with the we call bilateral simulation, basically left to right. Some people will do like eye movements. And what EMDR allows an individual to do is, overcome some of the disturbing events that may have taken place back in their life and kind of regaining back some of that control again.
Yeah, I've heard EMDR or eye movement desensitization and reprocessing therapy is a really powerful tool for trauma. Do you use it for other types of challenges that people might be coming in for as well?
Yeah, there are studies with EMDR that can help individuals with depression, even OCD, and but a lot of it's going back like in time in a way to see where the source is coming from, capturing those moments and connecting the mind, body, and the emotions along with it. And that's what the tappers allow us to do, to kind of like reconnect all of those fragmented pieces that some of those events left.
It sounds like a great way to tap into the body, even during talk therapy, which is very much kind of often in the head. Um, I also understand you do grief recovery method as a therapy approach. Can you tell us about that?
Yeah, so when it comes to grief recovery method, we talk about a lot of losses that an individual may have encountered. So maybe the immediate loss that they may be experiencing, they want to like overcome it or like come to an acceptance. So what grief recovery does is we use a handbook. So it's more manualized, but we work together to address some of the losses that they have experienced, whether it's like a loss of someone who's close to them, a pet, or even loss of like a job or sense of security. So we go through a lot of the losses that an individual may have experienced, and see like how they overcame it, and emphasizing some of their like strength during those process and also working towards acceptance.
That's great. And Shireen, do you have a message for clients who are seeking therapy at this time or who might be, looking to start therapy?
Yeah, so first of all, I want to say thank you so much for reaching out and embarking on this journey. I'm here to work together, and help you live your best life and accomplish goals that you set out for yourself.
Awesome. Well, thank you so much. I really appreciate it.
Of course. Thank you for having me.